How fast can breast cancer spread? Breast cancer is the most common cancer diagnosis among women in the United States. It is very hard to estimate how a person's breast cancer will change over the course of a year. Different types of breast cancer grow at different rates, and many factors affect its growth and chances of spreading. This video looks at how quickly breast cancer might spread, common ways that breast cancer can progress. How fast can breast cancer spread? It is hard to say exactly how quickly breast cancer can grow, including the time frame, as the disease affects each person differently. Cancer occurs due to mutations in human cells. Mutations do not follow normal predictable patterns of cell division, so it is difficult to predict the progression. Tumors appear when damaged cells replicate over and over to form a clump of abnormal cells. Breast cancer cells can break off and move through the lymph or blood vessels to other areas of the body. If breast cancer cells begin to grow in another body part, this is called metastasis. Breast cancer is most likely to metastasize to the lymph nodes, lungs, and bones. Regardless of the location of the new tumor, doctors still consider it to be breast cancer. Breast cancer growth and its chances of spreading depend on the following. Type of breast cancer. Breast cancer can be invasive or non-invasive. Non-invasive breast cancer will not spread beyond the ducts or lobules. Invasive breast cancer can spread to the surrounding connective tissue, the lymph nodes, and other areas of the body. Grade 1 to 3. A doctor will grade breast cancer 1 to 3 based on how much the cancer cells look like normal breast cells. Grade 1 is a slower growing cancer. Grade 3 is a faster growing cancer. A higher grade means that a cancer is more likely to grow faster and to spread to other areas of the breast or body. Stage 0 to 4. Healthcare professionals describe the extent of breast cancer progression in stages. This information is incredibly important when making decisions regarding treatment. The stages of breast cancer are as follows. Stage 0. Doctors consider breast cancer at this stage non-invasive, and it is only present in the ducts or the lobules. Ductal carcinoma in situ is a form of stage 0 breast cancer. Stage 1. Breast cancer at this stage is invasive, but it remains small and near the primary site. Stage 1A involves tumors that are 2 centimeters or smaller and have not reached the lymph nodes. At stage 1B, the cancer has reached the lymph nodes. Stage 2. Stage 2 breast cancer is invasive. Tumors may be larger than in stage 1, and the cancer may have spread to the lymph nodes. Stage 3. Stage 3 breast cancer is invasive. Tumors may be larger and cancer has spread to the lymph nodes, possibly to several. Breast cancer at this stage has not spread to other organs. Stage 4. Breast cancer has developed in other areas of the body outside the breast and lymph nodes, often in the bones, lungs, brain, or liver. Treatment at this stage focuses on controlling the cancer and preventing it from spreading any further. Personal factors. Growth or spread within a year will often depend on personal factors including age at diagnosis, hormone status such as pre or post menopause, family history of breast cancer, exposure to alcohol, cigarettes, or pollution. Previous history of cancer. Response to treatment. A doctor may also take how a person responds to previous or current treatment into account when working out the likely change or progression of cancer. What to know about breast cancer growth? Breast cancer occurs when normal cells mutate and multiply faster than usual. One cell divides to become two cells, then each of those cells divides to become four cells, and so on. The uncontrolled multiplication of cancer cells creates tumors within the breast tissue. The speed at which a cancer progresses depends on the growth rate of the cancer cells. It is hard to estimate cancer growth because not all cancer cells multiply and divide at the same speed. In most cases, breast cancer initially develops in either the milk ducts or the lobules, which are the glands that produce milk, before expanding into the breast tissue. Breast cancer that develops in ducts or lobules can spread to the connective tissue. From there, it can spread to the surrounding lymph nodes. Once in the lymph nodes, the cancer cells can enter the lymphatic system or the bloodstream, or they can move to other areas of the body. One recent study looked at the growth rate of invasive breast cancer tumors. The researchers reported that certain types of breast cancer, such as triple negative breast cancer and HER2 positive breast cancer, grew at fast rates.